Independence is a precious gift for accountability. It allows us to say the things we need to say, to speak truth to power.
I think it was a very different process and brought an experience that's very valuable for the future of the Sustainable Development Goals.
Now the MDG era is over, I hear a lot of people say we have to stop with business as usual. And I could not agree more on that.
The Independent Expert Review Group, the iERG, which was set up principally to review the progress for maternal-child health within the Millennium Development Goals, has just finished its work by producing the final report. It has been one of the most important bodies of work that I've been personally engaged in, and its importance lies in the fact that not only did it look at things from the vantage point of how much progress we have made across the world, but also importantly, how that progress relates to data variations, inequities within countries. Importantly, what are the actions needed to redress some of those challenges, and how they may relate to what the world needs to do in the next 15 years post the Millennium Goals.
You have to have an accountability mechanism that engages the community, that builds on the strengths, that uses the structures within the community, builds up to country level. Any accountability mechanism has to start in the family. The mother must be involved, the children must be involved, adolescents must be involved, the fathers must be involved, community leaders must be involved. This is what sustainable accountability is about. And from there, from that level, where you have an accountability mechanism that takes in all the stakeholders and comes together with a compact that assigns responsibility to each stakeholder, that enables you to measure the progress in the attainment of the goals that have been set by the people of that country. That is what constitutes accountability. And it is from these accountability mechanisms and structures that are at country level that we must interpret the international accountability mechanism. It has to be based on accountability structures at community level and in countries. This is the sustainable accountability that we want for Sustainable Development Goals. Sustainable Development Goals are about the people. These are the people's goals, and the people's must be in the driver's seat.
We brought a model of independence, which is very important, and this is crucial for the achievement of the Sustainable Development Goals. Now, one element that I would like to see improved in the future is a closer tie with mechanisms at the country level that will make the countries accountable to their citizens too, because that's where the final accountability rests.
Many times we think of what we deliver in terms of health services, but we don't think about the environment in which we deliver those services. When a woman is getting services, or a child or an adolescent, they should feel dignity. They should feel that they are being treated with dignity. That at the end of the process, part of our health that we are providing is a sense of dignity, that we respect them and we see them as dignified human beings, so that at the end of it all, they are feeling good about themselves, even if they are feeling sick.
Women and children are suffering in poor countries to the extent that they do, because their human rights are not honored, because they are violated. That's the real bottom line. And I think accountability is therefore the most important thing that we can do to support them and to avoid these tragedies.
Over 1.8 billion people, that is a full 20% of the world's population, is young people. And of these, nearly 90% live in the developing world. As the era of the Millennium Development Goals comes rapidly to a close, it is this largest, most dynamically informed, most connected generation the world has arguably ever seen that will inherit the next development agenda. These young people, a full 45% of whom live on less than $2 a day, will be the key beneficiaries, and by 2030, arguably the key partners in the new development process. That their voices be represented, their ideas and their needs be integrated into every step of the implementation of the global goals, of the accountability of the global goals, is therefore not only integral to the process's integrity, but essential for the sustainability of the goals that the global community has now rallied together to establish.
From the beginning of its work, the iERG viewed accountability of donor commitments, donor funding as a central element of our work. I think that today there's a much improved capacity to actually track the level of flows and the sources of flows toward RMNCH. Less successful has been an effort to understand support for the leadership and stewardship functions of the UN agencies that play such key roles. We need to know more about donor flows to support these organizations, and we need to support them much more substantially in the future.
I think that the SDG era has to be an era of action. We know what has to be done. We know how it has to be done. We have the financial means to achieve what we want to achieve in the SDG era. What is often lacking is the political will to really do it. Independent accountability is going to be extremely important in the SDG era. To make sure that politicians know that they have a tremendous responsibility as to promote the political will to achieve the better for the people on the ground, and that politicians are to be held accountable by the people in their day-to-day lives. And that politicians know that they are accountable to their people and not to the donors. Donors also have to be held accountable. My wish for the SDG era is that it is an era of action that shows finally, the political will to make the difference we all know is possible.
So when we think about the lessons learned from accountability, we know that rapid progress is possible. We can make dramatic reductions in child and maternal mortality based on the things we know. But we also need to remember that accountability is not free. It costs, it's expensive, so invest in it. Accountability isn't based in Geneva at WHO, it's based in countries where the action really is. Accountability isn't just about monitoring and measuring. Accountability is about reviewing the data in a participatory, democratic way and then doing something about it, acting. And accountability is about a vision for the future. It's about thinking about not just numbers, it's about thinking about people. It's about equity, it's about dignity. It's about the lived experience of women and children and adolescents worldwide. They are the people we serve. They're the people we have to think about first and foremost in our work. But if we get it right, the opportunity is incredible. Over the next 15 years, if we apply what we know now, we know we can save the lives of over 35 million women and children worldwide. That's the prize that we have before us. The challenge is to seize it.